there are so many creams that in the market can use for acne problem. If let's say your acne is very severe, sometimes those cream you can't help. So I would say if your acne is in a mild and moderate stage, yes, you still can get all these kind of cream. Try to calm down your acne. So basically what happened on acne is there are two main things. One is due to bacterial infection. So when it's bacterial infection, you need something that can kill the bacteria. So in the market, what kind of cream that can kill bacteria? Number one, clindamycin. They are antibiotics. Number two, azelaic acid. They are also bacteriostatic function inside. And number three will be this benzoyl peroxide. So basically these three can use to kill the bacteria. So do you need use three of them? Actually no. So it depends on how severe is your acne or whether you are resistant toward clindamycin. For example, you have been using clindamycin for many years, then there's no more function from the clindamycin because your skin is resistant to the clindamycin antibiotics. So maybe you need to have the other two to help you to kill the bacteria. So therefore, in later study, they recommend to use clindamycin together with benzoyl peroxide to reduce the rate of resistance towards the antibiotic that you use. So basically, epidural inside there are two ingredients, benzoyl peroxide and adapalene. Adapalene is third generation of this tretinoin acid cream. I don't really recommend put so much of cream in one go per day for if you want to treat acne. Let's go back to basic and make it simple. For example, if you see your acne is inflamed, big, swelling, and you have pus. If you have pus, meaning you have bacteria. So you choose from clindamycin, benzoyl peroxide or azelaic acid, either one. No need to use three of them. These three types of cream you can put daily twice and you observe 3 days what happened. So if let's say their response to the cream, normally they will calm down, they'll become more flat, not so swelling, and the pus will go. If this respond well, I think you don't need to add on another extra things on top of your skin. Azelaic acid can help you to reduce the dark color mark, red color mark. Yes, correct, because azelaic acid, tretinoin cream or even adapalene have this keratolytic function. Keratolytic function means they enhance skin growth rate, become faster. So they faster the skin cycle and remove the old skin and the new skin come out. Therefore, you can reduce the pigmentation problem and also the red color mark. If you tell me you want to use azelaic acid for your mark, yes, then you choose either azelaic acid or tretinoin cream. You don't put both because if you put both, it may be overwhelm the function and maybe you will irritate your skin and make it worse. The Cica and the B5, I understand a lot of people recommend that after you have damage on the skin, you have red mark, you can use the Cica B5. Yes, if your acne is already recovered, and please try to not to use those very oily ingredient or very oily texture in terms of the Cica balm, because you know the acne skin is equal to oily skin. If you use something more oily on the face, it will make it worse. So your acne might be recurrent again and you will never see a good result because the old mark haven't have time to go on, then the new acne coming. Yeah, Cica you can use, but please put on those marks that are fully recovered, and I would recommend only put on spots. The last one I would say, please be patient because you can't see result in few days time. So you want to see a very big changes in terms of your skin condition and then the marks is removed from a very bad to a very good result. Normally I would say it will take around 2 to 3 months time. 2 to 3 months is because our skin cycle the fastest is 28 days. 28 days is 1 month. So meaning I use 2 to 3 months time, I only change my skin 2 to 3 times. The old mark will gone and then the new one will come out without the marks. If there's no upcoming acne. So if you have upcoming acne, I'm sure you will feel frustrated because you can't see the good result. Let me make it very simple. For those who want to maintain their skin in a very good condition by using all this topical cream, just get yourself a spot treatment. For example, clindamycin plus benzoyl peroxide or benzoyl peroxide plus adapalene, the epidural. Or you can just use pure clindamycin. This is called spot treatment. So this kind of treatment, you use it 2 to 3 times a day on the particular spot only. On top of that, if you want to make the blackhead or those comedon reduce by using topical thing, you can try to use some salicylic acid pad, even the physical scrubbing. Even you can use a full face topical tretinoin cream or retinol. That I will recommend for those who are going into phase of maintenance. You just need these two. One is for treatment treatment purpose on the spot acne. Another one is to help your skin to exfoliate, to reduce the dead skin layer, and therefore there's no blockage on the skin. No blockage means there's no chance for you to have comedones and reduce your risk of getting acne. So normally we need these two types of agent to help on acne prone skin. Keratolytic agent, there are a lot in the market. For example, like retinol, tretinoin cream, salicylic acid. Even azelaic acid also is a keratolytic agent, but I don't recommend to put full face. So normally I use tretinoin cream, or I use the physical scrub, or I even ask them to use salicylic acid. All this is quite okay to use and not much of complication. First of all, if you only apply clindamycin, actually they don't have much big issue. The only big issue will come in is if one day you are resistant to clindamycin, that means the clindamycin no longer going to help you. So that's the biggest problem if you use clindamycin alone. So the risk that always carry by if you go and take the medication yourself is you don't know what to expect. You don't know what's going to happen if you use this kind of cream on full face. Okay, for example, I'm sure a lot of people nowadays they like to use retinol or even tretinoin cream. So they do not expect what kind of side effect is going to come in. So most of the time, if they don't have guidance, meaning they don't have someone that who know what's going to happen, tell them, okay, this is normal, this is not normal, normally they will give up. So if you give up in the halfway, you're definitely not going to get any result from the cream. My favorite cream will be my tretinoin, but a lot of people will say, oh, Dr. Tretinoin in the market, a lot of people say it's too strong or they have a lot of side effects. You must understand that tretinoin, I want the side effect. I want the peeling. I want it will give you a little bit of mild irritation, mild red. That is the side effect of the first generation tretinoin cream. That is the part that I want. If you don't want to have irritation, you don't want to have the severe peeling one, you can go to third generation tretinoin cream, which is adapalene. But if less peeling means less effective, I want the peeling. So the peeling won't last for very long. Normally lasts for 4 to 6 weeks. If you don't know going to let you peeling after you use this cream by yourself, then you will say that, oh, this cream make my face dry. But the truth is, no, your face is not dry, but your face is in the process of peeling. If there's no one to guide you, maybe in the third week you're going to give up. So you still cannot get what other people mention on the social media, say, oh, this cream is very good, my skin is glowy, my skin is shiny, my skin less comedone. Yes, it will give you this kind of result if you continue until you pass through this. I would say it's a transition period. Normally it's 4 to 6 weeks, normal people. Is there anyone that not suitable? Yes, of course, it's medication. So whether you're suitable or not, I'm not sure until you start using. So therefore, we are here to help you guys to know when to start use, when to stop using. If let's say the side effect is overwhelming, is too much, then we have another way of ask you to using kind of keratolytic agent. So my usual one will be like, oh, you can drop down to 1 week, you use 2 times first. Yeah, if it's okay already, then you can continue 3 to 4 times per week. Slowly you step up. That is how we make your skin get used to it. For me, I would say most of the people can use the cream. It's just that some they are more sensitive towards this medication. That's why their side effect is a bit more stronger. Yeah, but eventually the side effect will slowly, your skin will get used to it. Then the side effect will slowly come down, and then the result will be there.
Can you permanently remove acne by following the online tutorials? Like, if yes, what are the right approach?
If you're oily skin type, I wouldn't say 100%, but 99% is impossible to get rid permanently. Because why? If you're born with oily skin type, your skin will be oily maybe until your age of 40, 45, 50. Then only you become dry because of aging. Even myself now, I'm 39 this year, I still have acne. Not all the time, but sometimes if the oil gland very active. So if you do all this kind of like sleeping late, all this, you're going to have acne again. If you say like permanently remove, I would say no, but you can use a correct method to maintain your skin, to reduce the risk of your getting acne as much as possible. Yes, there are a lot of ways. If you say, if I do all this, do I still get acne? I would say, yeah, I would still say that you maybe get 1 or 2 when the times that you are stressed, you not enough sleep. Yeah, I think it's very normal. But as long as this acne comes not in a very large amount, maybe like 1 or 2, I think it's normal. If you really have that kind of lifestyle and you cannot avoid, and your acne is so bad, please go and find a dermatologist, get a oral tretinoin to control the oil. Everything will resolve. Same thing, it's just a temporary thing. So after you stop the medication, if your lifestyle is continuing like this, maybe you'll get back the acne again.
I see. So you don't have any medication that we can take for long term and then without
I would say
significant side effect?
No, I would say no. But I don't know when this laser machine gonna come in. It's called Acne. There's one laser machine was launched in 2 years ago, and last year went into Bangkok. This particular new laser is designed for acne-prone skin. Okay, what they do is after 4 sessions of this laser, they will reduce the oil gland activity by I think 90%.
Wow.
For the study is 2 years, so the duration of 2 years. So in these 2 years, all these particular subjects have severe acne one, do not have acne for the next 2 years without any medication.
I see. Wow.
Yeah, just only by doing the laser treatment. I'm not sure when this laser machine gonna come into Malaysia, and in Europe there is available. Like for example, if you go Italy, they are available in Italy already for the past I think one year, 1.5 years. And then the treatment also is not cheap. According to my Thailand doctor friends, 4 sessions of this laser treatment are going to cost you around 12,000 ringgit.
12,000.
Yeah. So you can roughly count and see 12,000 for 2 years. Is it worth it or not? It's all up to you.
If let's say Malaysia government allowed this machine to come in, and then would you make the decision to get one yourself?
You need to think on not from medical side, it's from business side. Because the machine in Thailand they sell 250,000 USD, so it's almost a million ringgit. Then I'll ask you back this question: would you spend 12,000 on your face to do 4 sessions of laser to get you acne free for 2 years?
Really hard to say.
Yeah. So this is also something I always ask myself: is my patient here going to be willing to spend so much just to get rid of the acne for 2 years without any medication? That one just leave it. When the machine really come in the time, then let's see how maybe the time the machine is not so expensive and more manufacturer going to make the same laser that can sell in a different price. I'm not sure. Same goes to pico laser. At the beginning it will be very expensive, but by years goes by, pico laser the price
because of advanced technology advancement.
Yeah, and also there's more manufacturers that can make a pico laser. So there are some pico laser is a bit in a low price side. Yeah.
I see. Sure. Doctor, thanks for all the advice and the whatever. Thank you.
No problem.
Alright.
Okay.
So